Perception. What number is actually on the ground? Well, that depends on how you look at it. If you're the person standing on the right side, you may see it as a 9. Yet, when looking at the same number from the left, you may say it's a 6. You see, perception is everything.
Good day. I'm Yolanda Muza, a pharmacy postgraduate student, and my research topic is entitled Older Adults' Perceptions of Pharmacists as Care Providers. Imagine you're an older adult. If you fall sick, where do you go? It's either you visit the doctor, who would then prescribe some medicine for you to take, and where do you get this? From your pharmacy. Or you may decide to self-medicate by simply visiting the pharmacy on your own and asking for a recommendation of medicine. Ultimately, the point that I'm trying to make is that all roads lead to the pharmacist. Truth of the matter is, pharmacists are usually the last group of healthcare providers that the older adult will encounter before self-administering their medication at home. What an important role. And because the elderly are a particularly vulnerable group, that care needs to be specifically tailored for their individual health needs. And for older patients' needs to be sufficiently met, pharmacists need to note the acts that constitute these caring behaviors and define them through the eyes of the patients. The goal of my research is to basically change the focus of pharmacists away from a drug or product-oriented role towards a more patient-centered role. Employing the patient-centered approach means that pharmacists need to understand what care really means for the older adult from the patient's perspective and not theirs. They need to engage with the elderly and discuss their experiences of pharmacists as healthcare professionals and care providers, their expectations of pharmacists, their perceptions of the quality of care received from pharmacists, and their views on how pharmacists could make a more significant contribution towards their health outcomes. Through interviewing older adults, my research will seek to find ways to enhance the relationship quality between pharmacists and the elderly. It will help identify gaps that currently exist between pharmacists and older adults and how best these gaps can be bridged, ultimately leading to better therapeutic outcomes in this population group. Thank you.